Hi, Giacomo.
Hello.
How are you?
Fine, thank you.
Thank you. First of all, thank you for participating in the online virtual International Student Day for OsEAN students. And I would like to ask you a few questions about the workshop you will present in this International Day. So first of all, we would like you to introduce a little bit yourself and the school you teach in Italy.
Cool. So, hello everybody. I'm Giacomo Consorti. I'm the coordinator of Education Department of Osteopathy of Istituto Superiore di Osteopatia, ISO Milan. And that's pretty much it. I teach in a couple of courses in osteopathic principle the first year, and in a clinical tutoring of course, and in research methodology among the whole year of course.
Nice. So could you tell us a little bit more about the topic of your workshop? What will you talk about, or what are you going to do in it?
Sure, it's about bringing theory in practice, about neuroscience of pain. So basically, we will see how to use some framework for interpreting the clinical presentation of patients to kind of take it very kind of label the pain of patients in three main categories, which are neuropathic, or rather than nociplastic, rather than mechanical pain, according to the IASP nomenclature of pain. And then we will see how four of the main influencing factor of perceiving of patients' perception of pain may influence the clinical presentation. So basically, we will be able to address our clinical impact on patients on a neurophysiological basis. So
Okay.
that's what we are going to do in very brief.
Okay, and it will be a very practical workshop.
Sure. Actually, I'm totally against lecturing, so I really can't do this. Me talking to students about something doesn't mean, from my perspective, I am teaching. I'm just talking. So in order to teach, they need to do stuff. So the workshop will be completely practical. There will be a mini lecture in the beginning, kind of 15 minutes of me blah-blahing about pain and what it is and the classification of pain, in order to make students able to do the clinical cases after. So what I had in mind was to do a small groups learning activity in which the students need to use a specific framework for pain on clinical scenarios. And then we will discuss the results on that.
Okay, so as a conclusion, in one sentence, why do you think that the students should follow your workshop?
Because we are in 2020 and most of our practice, as we are used to think about it, not always rely on neurophysiology of pain. So it's kind of time we update our practice with something more, 2020-ish style. We are going ahead with science, so we as healthcare professionals needs to stay updated in that.
Yeah, sure. Okay, thank you, Giacomo. So we encourage all the students to follow your workshop, and I'm sure they will be delighted with it.
Thank you, Sandra. See you there.
See you. Bye.